In this video, we demonstrate application of the Baffle planner to a patient with SDD double outlet right ventricle, sub-aortic VSD, and a prominent conus. The surgeon was concerned about the potential for left ventricular outflow tract obstruction. Viewing the heart externally, the aorta is rightward of the pulmonary artery. From the left ventricular view, we can see the ventricular septal defect. From the right ventricle, we see the VSD just below the aorta, as well as the outflow to the pulmonary artery. Our surgeons were concerned about the presence of this prominent conus and the potential for obstructing an LV to aorta pathway. In this context, the surgeons hypothesized 3 possibilities for repair, which we will now demonstrate in virtual reality. We have found virtual reality to allow an interactive perspective for the interrogation of baffle pathways that is difficult to achieve with traditional visualization. First, we show a baffle from the left ventricle to the aorta. We step into the left ventricle to visualize the baffle. Validating initial surgical concern, the LVOT appears to be narrowed in the region of the conus, prompting discussion of whether some of the structure can be resected or whether the VSD could be safely enlarged. We then step into the right ventricle to visualize the baffle from that perspective. Finally, we look down through the aorta at the baffle to provide a third perspective on this potential repair. Next, we show a baffle connecting the left ventricle to the pulmonary artery. Once again, stepping into the left ventricle of the model, we can visualize the baffle from the VSD up to the pulmonary artery. This pathway appears unobstructed, but because this would make the right ventricle the systemic ventricle, this was not strongly considered. Finally, we show an example of a baffle connecting the left ventricle to both the aorta and pulmonary artery in the setting of a potential Damas case stancil anastomosis. Stepping into the right ventricle, we assess the size of the baffle and the amount of space it would potentially take up in the right ventricle. And finally, look down through the aorta and then the pulmonary artery down at the baffle patch.